Okay, so yeah, so one of the papers that I shared by Nancy Cass is a classic paper, and I would say that it's something which, as public health people, we all should be, um you know, acquainted with, we should be familiar with that paper and what she has mentioned in as principles of public health. We know that in medical sciences we have ethical principles. But some of I mean the framework that we use in medical ethics may not be completely as such applicable for public health because we work in a different setting. So that's why over about 20 years back, I think 15 or 20 years back, they developed this framework, um, uh, on public health ethics. So that is something which you can use it when you discuss public health issues, um, program design, in all activities that we do in public health. That's something which can help you to decide whether you are doing something right, or whether we are following some ethical principles in designing a program. It's not widely used, I know, but I think that's something which at least for the you are going to lead the public health in the coming years. So um, it's good to have go through those and get familiarized, and try to use it in your writings, in your research work. When you start working, always keep these things in mind when you start applying your learnings, your epidemiology or your health systems or anything. You start using the ethical frameworks as well when you sort of think about programs. So I am sure all of you are updated with what is happening around the world. Why, I mean, why we have to discuss quarantine, um, yeah, especially what's happening with the coronavirus, that is fast emerging as a global public health threat. So that's why I thought of discussing some of this aspect. I mean, this is not a theoretical lecture, or I will not be. I'm sure. I mean, most of the things that I'm going to say will be familiar to you, but it's just like giving some inputs, in the context of the emerging emerging infections, in the terms of new infections, as well as re-emergence of old infections, which you are starting to learn. So I mean, before I go further, like I mean, is it all first year MPH? I mean, am I talking to first year MPH or second years? Can you hear me? Hello? I think there is some problem with the audio. Okay, anyway, I will continue. If it can be sorted out later, we can have some discussions. No problem. So I hope it's a mix of first years and second years, and some of them will be familiar with what some of the things which I am going to say. Of course, things are there in the news, and we are getting reports and things every day. So you might have heard that uh, this Dr. Lee, a few hours ago, he passed away. So he was the doctor who actually took the risk of alerting the public or the media that uh, this current infection in China is something unusual, and um, it's something serious. He was a 33-year-old ophthalmologist working in the Wuhan province, where we have this infection now, which is the source of infection that the world is witnessing now. So he was involved in the care, and he was diagnosed with the corona a few days ago, and unfortunately he had to lay his life a few hours ago. So actually he was arrested when he came out openly saying that this is a serious issue. um, okay, so we started that note. Uh, and like public health is, public health was there for centuries. One can argue, public health was there, discussed in ancient scripts, and it was practiced in different forms in different cultures and different civilizations. But as an organized entity, organized science, we can say it started around 100 years ago. And public health is different from medicine because it tries to improve the health of the population rather than individuals. So the aim is to improve the health of the population. But in doing so, public health always faces some dilemma. Uh, you know, even even if you see 100 years ago, when the smallpox was around and we had a vaccine on smallpox, um, uh, you know, there were resistance to vaccines because people, especially in some of the countries where the individual liberty, individual freedom has highest values. So it has to have a balance between how much public health can go, and how far you can go before you are actually infringing on individual freedom and liberty. So that there are a lot of ethical issues. If you take the whole history of public health, you have a lot of ethical dilemmas which have come in various interventions, that public health interventions that we had. And some of them are in the research front, some of them are in actual programs or disease control programs, which may be discussed even some of the other classes. So actually, this is not something new. Quarantine, again, quarantine is nothing new. Quarantine was there many years ago, but it was in different forms and formats and for different diseases. But as of late, after a long gap, we are seeing in the last 1 or 2 decades, the world is witnessing increasing number of quarantine incidences because of, as I said earlier, emerging new diseases as well as re-emergence of all diseases. So this is actually a dilemma for public health professionals, like how do we handle quarantine? So this is some of the aspects of which I will be discussing in today's lecture. So this was on Bloomberg, reporting on 31st of January. When the SARS outbreak happened in 2003, 2004 in China, he was the one. There was one economist who calculated and predicted like what is the economic cost of SARS epidemic. So now he says, he's predicting that the 2019 corona will be much worse, having much worse impact than even SARS. So this is, and he is a widely accepted figure, and and his calculations and predictions are taken very seriously. So he says that it will be around 3 to 4 times more than SARS. And that is something very serious, and that's very alarming. Can you see the slides? Okay. So he's a professor of economics at the Australian National University, and he was the one who predicted about the impact of the SARS at that time, which came true. And he's saying that it's going to be 3 or 4 times than SARS, which means it's more scary. And for him, if we take his words, panic is what seems to be the biggest drain on economy rather than deaths. So, we know that even for SARS, the mortality rate was around 3.5%, which is almost similar to a normal influenza. It's the same mortality rate, but we know that it's the fear of these infections on one side, and at the same time, the fast spread and the panic that it creates, which is actually creating more influence or drain on the economy rather than the deaths. So some of you, if you have followed, I am sure that as public health people, you have started practicing the following the important organizations in working in public health, like the WHO or the UNICEF or UNAIDS or World Bank. um, and the ministries of health, you should all try to follow news and updates from these organizations and entities to be updated on what is happening in the world of public health. So, if some of you have watched last week when the WHO Director General, actually, he went to China when this outbreak was officially declared to meet with authorities, and then he conducted a press meeting, press brief, where he declared that this is a worldwide threat. So if you have seen his body language when he was doing that, it was very clear that he was absolutely careful in using words. In fact, there was, if you have seen that, even if you can go back and see, if you go to the Twitter pages or Facebook pages of WHO, you can still go and see what he actually talked. And there were a lot of questions from the press people, like um, on whether WHO recommends an international travel ban, which he categorically said no. So because it has a lot of implications in terms of economic cost. Um, yeah, so he was reluctant to announce a travel ban, even after repeatedly he was asked. um, so that is something which is very seriously considered, especially China in 2003 is not the China in 2019. The economy has changed a lot in these years. So in back in 2003, China was accounting to around 4% of the global GDP. But now in 2020, you know, share is increased to 17 percentage. That means almost one fifth of the global, GDP is from China. So, so if some is China's economy is affected in some way or other, it's going to have a huge impact in all the countries, all the economies of the world. So there are two issues here. One is um, there is the unwanted panic should be avoided. At the same time, uh, and, and second, at the same time, China has to be taken into confidence uh, because of our previous experience with SARS, which I will come to that later again. So I hope you are familiar with Corona, which I am talking about. I hope you have also some idea on what was the SARS, and that all these are a group of viral infections of the same group of viruses, primarily producing influenza and pneumonia, primarily respiratory failures, which will lead on to death. Of course, there will be multi-organ damages and things like that. It spread. Um, uh, it spread between people, and most of them either do not have a vaccine, or do not have a medicine to be used to cure it, because these are essentially viral infections. So I hope that this background is clear to you. I mean, at least you can go back and read. I mean, I'm saying that you can go back and read about the infections, all the different coronaviruses. Also, you may be familiar with the MERS coronavirus, which is a Middle East respiratory virus. That was again that started as an outbreak in Saudi Arabia around 2013, and then it started essentially with from camels. It got transmitted from camels through unboiled consumption of unboiled camel milk, or not properly cooked camel meat, and also among people who were actually taking care of camels. So again, the mortality rate of MERS is pretty high than these coronaviruses. It was pretty high. So still the infection is still there in some provinces. It's still continuing. But of course, the major outbreak was stopped once the root cause was identified as MERS corona, and that the primary source of infection is camel, because then there was a lot of information, education, communication campaigns asking people to use olive oil milk, to properly cook camel meat, and to take care of when you are taking care of camels, to be careful on that. So that's how they controlled it. And of course, at that time again, one of the major group which was affected was healthcare workers, because at that time in 2013 12 12 13, when the outbreak happened, Saudi Arabia was the health system. I mean, all these outbreaks exposes the weaknesses in health system, which I will have some slides again, which I will show you what are the health system factors which contribute to failures in managing these outbreaks. So basically, that even at that time, a lot of healthcare workers, many of them from India and Bangladesh, who were working in hospitals in Saudi Arabia, were affected. So this actually led to a lot of intervention in the Ministry of Health, bringing in very strong guidelines and systems of practices in prevention of infection control, which actually had impacted not only in MERS corona prevention or control, but also in other hospital-acquired infections. I would say, going by my experience in Saudi. So, so these are all, sometimes this all come as a good thing in a way that it helps to improve health system issues. So same was with China, which I will come to again in some details later on. So, so as I said, even though the mortality rate is similar to SARS, the corona of 2019 seems to be more contagious than SARS. Even maybe it is less deadly as of now, but it is more contagious, means it is spreading faster than SARS. For example, as a comparison, 8,000 SARS were reported between November 2002 to 2003, when it spread from China to other countries in Southeast Asia and the North America and the Europe. I mean, almost all countries had SARS, but then it was around less than 9,000 cases. But in less than 2 months, I will show the updated figures in a while, but in less than 2 months, for Corona 19, we have already 10,000 people. So that means Corona 2019 is a far serious contagious disease, even though the mortality rate may be similar or less than SARS. So that is why the panic is, and that is why many airlines have stopped flying to China, and there are countries which have blanket quarantines in place, like Saudi Arabia, for example. They are not allowing anyone who comes from China to go to their homes or come out of the airports, and they are put up in the airports, of course, with providing all facilities. So there are a lot of technological advancements that we have. So as public health people, I would say that you should use the available resources. You should experiment yourself. You should learn yourself a lot of things. Go to the internet and explore potential sources of data, and see like what are the different ways of data interpretations and data representations. There are a lot of opportunities in today's world. So you should always try to learn new things and go and see like how data can be represented, how it can be represented in a very impactful way. You can see this map, it has spread far and wide already. It has spread far and wide. um, Except Africa, you can see almost all the places are affected. And it's possible that Africa might have been also been affected, um, because of weaker health systems in many of those countries. Maybe they are not diagnosed. So this is just a while ago, in the morning today, Bloomberg again, China lashes out at countries restricting travel over virus. This is what some time back I was saying. 2003, China uh, didn't reveal to the world about the virus for a long time, when the SARS happened. And it was a disaster, as we can see later on. But this year, as I said, the WHO Director General himself going to China, discussing with them, taking them into conference, very careful in the press meeting. And even the WHO directions are very, very carefully worded, and it's not saying any travel ban. But we know many countries have, banned people coming from China to enter their own countries. So this actually sometimes may backfire, because China will have its own interest and may take some decisions which may be harmful in the larger public health interest. So this is a picture from January 30 in Shanghai, a substation. You can see, subway station. There is no one there, and some of the cleaning staffs are walking. And you can imagine the amount of impact on its economy. And some people say that it is going to bring down the GDP by at least 2% points. So which is more than the GDP of many African countries together. That's huge impact on global economy. So this is again one of the sites which I would encourage you to go. This is by the John Hopkins University. They have put up a special site for coronavirus tracking. I think many of you have already seen this. So on the left hand, you can see an image which I cropped at 10 o'clock in the morning, and another one I took it at just some time back, like half an hour back, before I finished my preparing the slides. So you can see, like in a matter of like 12 hours, from 28,353 cases to 31,472 cases, from 565 deaths to 638 deaths. It's it's fast spreading. It's really fast spreading, and you can see the number of cases in Japan. It went from 45 cases to 86 cases. So this is worrying, in from a global health perspective. So taking uh, a small look back to history, which I was trying to say a little while ago, when I mentioned about the SARS. So SARS appeared in November 2002 in China, but the world was told in February 2003. So we already lost around 3 months uh, before actually the cases were supposed to be diagnosed. So then after that, it spread far and wide, 24 countries before it was actually controlled. And the last case was in 2004 May. So you can see the graph, like how the mortality, how the incidence has been very, very fast and rapid. Um, so yeah, so there are a lot of implications in terms of quarantine, in terms of public health activities or actions that countries and regions can take in terms of preventing a global spread of infection. But again, SARS was not the first time. The world has seen pandemics. So what is a pandemic? So as you know, pandemic is something which has been spread around the world. The infection has gone to multiple regions of WHO. Wherein it has, as a pandemic means it has infected, or it has reached almost all the countries in the world, at least all the continents. So it's 1918, there was a huge pandemic, and that was the last wide scale pandemic with high mortality rate as far as our history is concerned. So before that, there were many more pandemics. Classically, there were 3 pandemics in history. You can go and read on the influenza pandemics. So this was like, and I'm talking from Boston, and Boston and Massachusetts state had some very interesting connection to the 1918 pandemic. So it had a background when in April of, that was the time of the first World War, and they started with around 380,000 army men. US entered the war, and in 2 months from then, the government decides to increase the number of army men. So they started to have large recruitment of army men using a camp approach. Just we know, like in India, we have, we army conducts camps to recruit people. So similarly, they recruited, people and started to put them in together, like 25,000 to 50,000 people together in each camp. So it's huge preparation because the World War is going on. So meanwhile, in the March of 1918, a small influenza outbreak happened in United States. And then within a few days, Kansas City started to have influenza among its soldiers in the camps. And you can imagine, the camps are holding thousands of people. And if an influenza-like illness get into this group, it spreads so fast, and the living conditions are not as good as we can think even today. So it like, multiplied, and the cases went, so high. And it is estimated that in the month of October of the same year, um, the virus actually killed at least around 2 lakh or 200,000 Americans in just 1 month. So you can imagine the strength of that virus. So it's unmanageable. And I mean, things were not as good as we can imagine at that time. And many states, including like Massachusetts, even though they had a very old public health system, it was uncontrollable. And there were in subsequent months in many of the states, actually people were quarantined at their homes. They stuck notices in front and back of the houses, and saying that this house is quarantined, people have to stay inside, you cannot come out. And some months passed away and the war almost ended. Meanwhile, from the north, I mean, 1918 influenza was first, the outbreak first happened in America, and then it went on to uh, other countries in the Europe, Asia. Almost all the countries were affected. And in April 19, when the war was finally ending, and when all the allies come together to declare call off the war, it was reported that the US president at that time, Wilson, collapsed during the meeting. And some people say he actually was having flu when he was in Paris at that time, and probably that is how he collapsed. So because it was still there in Europe at that time, and you can imagine the number of people, the number of lives that were lost in one single epidemic or pandemic of influenza. So this is, we are dealing with something which is very, very serious from a public health point of view. So now let's have just some pondering on what is isolation. And I mean, we know that we have heard the terms isolation, quarantine. So what is quarantine? So I'm saying quarantine for some time. So what is quarantine? Can anyone say? So what's a quarantine?
They are saying, but it's not love. It says isolation and keeping them away from any contact with other people.
So what is the difference between isolation? I can hear Jinbert very clearly, but I cannot hear other people. I can hear Jinbert very clearly. So what is the difference between quarantine and isolation? Maybe Jinbert can repeat it for me. Okay, so I will put it across. Maybe next time we can have some arrangement on now managing this audio which will be really helpful. So what is isolation? So isolation is essentially uh, separating sick people with a contagious disease from people who are not sick. So isolation is essentially for sick people who are actually ill, and you separate them from people who are not ill. But in quarantine actually separates and restricts the movement of people who are exposed, but they are not sick. So they are exposed to a contagious disease, but they are not sick. They are not only separated, but they are restricted from moving, because we want to see like whether they are getting sick. So that's the difference between isolation and quarantine. So if you see in Kerala today, if you see I hope all of you have seen the protocol by the government of Kerala in this corona outbreak. So they have very clearly, outlined like who is going to be quarantined, who is going to be isolated. So I encourage you to go back and read it. It's all available everywhere. Just Google it. You can see like how it is structured. And of course, you may have some questions on that. We can take it in the end. So yes, this is from Massachusetts where I am. This is a hospital. It's a makeshift hospital, which was created at that time to manage the cases, because hospitals were full, and you know there was um, there was no space in hospitals, so they have to prepare and create new hospitals. Essentially they did it in the outside because they couldn't build hospitals like China is doing today in 10 days. US even today cannot afford to do that. So think of 1918, they just had to keep the patients outside. So I hope you can hear the audio.
Public health response is about people helping people. How we respond in threatening situations with long hours and uncomfortable conditions that wear down our patients can make as much difference as what we are there to do. As public health professionals, our goal is always to promote good and to prevent harm. We bring to our work a commitment to treating others with respect, fairness, and compassion. But sometimes, especially during an emergency, we forget. Right when it matters most, stress and pressure can make us forget to pause for a moment or forget to look someone in the eye and to put ourselves in their situation. Let's take the case of Sam. During an outbreak of Ebola, he is the leader of a burial team that's been assigned to this village. It's his team's job to safely collect the bodies of people who have died. Sam knows the very first thing he has to do is show his respect for people in the village by meeting with the village leader. The village leader will give the trained burial team permission to be there, and in turn, the leader will introduce Sam and the burial team to the families of those who have died. Once introduced, Sam takes the time to pay his respects to the family, to express sorrow, to explain what's going to happen, and to invite the family to watch the burial from a safe distance. He shows the family the personal protection equipment, which is commonly referred to as PPE, that the burial team will be wearing. Sam knows that if he bypasses these simple steps, word can spread. Without the village leader or village elders indicating their acceptance of the burial team, village members may reject the burial team and decide to bury their loved ones themselves. Ultimately, this would put them and everyone they come in contact with at high risk of infection. In this case, respect is showing understanding of and respect for the local culture and for safety too. When an emergency occurs, food and water may need to be brought to a community. Elias's job is to distribute these supplies. Elias finds this somewhat stressful, but he tries his best to hold on to his commitments to fairness. He knows that people will be talking whichever way he distributes the supplies. When word gets out that Elias makes sure that everyone gets their fair share and that everyone is treated equally, it builds trust in the community about the entire relief effort. In this situation, justice is served by distributing all resources fairly. While working at a local hospital, Amina is required to wear a mask within 2 meters of a patient. She has learned that if she puts her mask on with her patients and their families watching and speaks to them in a calm voice, it makes them more comfortable. She explains the purpose of the mask and states that she realizes the mask feels strange and scary, but that it's important to keep everyone safe. She has learned that the patients are more likely to comply with requests like these and to complete their treatment if she talks kindly to each patient and the family and explains what she is doing. Here, doing good and protecting from harm means showing compassion and giving treatment too. The technical work we do to save lives is critical. When we remember to do simple things like speak with a calm voice, look others in the eye, and think about how we would want to be treated in the same situation, we can be our best selves and get the best outcomes. Respect, fairness, and compassion are a crucial part of our response. Although this video can be used by itself, it was developed to accompany a detailed guidance document on ethics and disease outbreaks, including a set of PowerPoint slides. All three, the guidance document, slides, and this video, are intended for use by primary responders to disease outbreaks and are available online at bioethics.jhu.edu/outbreak_guidance.
Could you hear it? Sorry? Gilbert, could you hear it?
Yeah, we can hear, yes. Yeah, we could hear very well.
Okay, you could hear it very well. Okay, thank you. Okay, so now, what is this? What does it look like? Can anyone say? Any guess? What is this?
They said triad.
What does it look like?
Triad.
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 Any other guess? Wild guess? Okay. So this is basically a hotel, layout of a hotel in Hong Kong. Can you hear me?
Yeah.
So this is the Metropole Hotel in Hong Kong. So why do we discuss a hotel in outbreak? So you can see that there are certain things. Sorry. Can you see the slides?
Yeah.
Hello?
Yeah, we can hear, yes. Yeah. Can you see the slides?
Okay. So 1 second. Just a minute. Okay. So you can see it, right? So if you can see, there is something called the primary case patient room, confirmed or probable secondary case patient room, areas where corona, SARS-CoV positive environmental samples were, you can see that, are you seeing that?
Yes.
So this is the story of 2003 SARS. So SARS basically, so this was a hotel in Hong Kong, which is a very posh hotel, with 487 rooms. Um, and this hotel had some important guests um, in the month of February 2003. So there was a wedding in this hotel, a very huge wedding with hundreds of guests flying from different places and attending from different countries and different places. So in room 911 of this hotel, there was a guest, and that his name was Louis. He was Professor Louis. He was a respiratory medicine physician, and he was 64 years old. So what happened was that he came for the wedding from his city of or province of Guangdong, um, which is like a border place of Hong Kong, but in China. So he came here to attend the wedding. So basically, he lived in this room. This room. He lived in this room. Um, so he attended the wedding, but he couldn't finish attending the wedding. Then he walked into a hospital which is just across the street where this hotel was. So he went to the hospital called Kwangwa Hospital, which is just walkable distance from this hotel. On the next day of his check-in, and there are reports which says that he went inside and told the staff that just lock me up and don't touch me. I have contracted a very virulent disease. So um, he got admitted in the hospital, and a few days from then, um, he died. So the story was that actually Louis was a doctor in Guangdong Province Hospital, um, which had cases of SARS from November 2002. So this happened in the incident of the wedding, and his coming to Hong Kong happened in February 21. But he was actually a physician, a respiratory physician, working in mainland China's Guangdong province, where he was actually treating SARS patients. So SARS, again, the first case started with a farmer in one of the counties in Guangdong in November 2002. The first case, the index case, was 16th November 2002. But WHO was informed, the world was informed by China only in end of February 2003, by which time, through Professor Louis, it has reached many different countries, as I will tell in a while. So actually, even when WHO team finally came to investigate the whole incidents, Beijing actually prevented the team to visit even Guangdong for many weeks. So, I mean, as I said, the first case was a farmer in one of the counties in Guangdong province. But then the real, super spreader, what you can call like a super spreader, which is like the patient who actually widely spread disease, was a fish seller um, who gone to the hospital on January 31st. The same hospital where Professor Louis was working. So that patient is considered as a super spreader because he already got the infection, because the first person was a farmer. He infected some people. Slowly the infection spread, and this fish seller who actually finally landed in Guangdong hospital, actually he infected more than 30 nurses and doctors in the hospital, including Professor Louis. So going by the political climate and the administrative setup, um, the information, even in today's corona outbreak, this has happened. And as I showed in the first slide, when the doctor has to give his life, he was arrested because he told it out. It takes a lot of time from some information to reach the law upper level, and also upper level to or the national level to acknowledge that something is serious. Same thing happened that time. So what happened was that this doctor was involved in the care, and and later on, there's a history that later on US constituted high level committee to conduct a workshop, um, or to investigate what actually went wrong in China, which I will come to that what were the findings in a little from now. But there were a lot of system issues which actually prevented the diagnosis of or detection of the outbreak, even though a serious condition of pneumonia was diagnosed at the lower level. uh, People were suspicious that this is something unusual, this is not the usual cases that we usually see, but the reluctance that how it will be taken up by the higher authorities prevented them from reporting properly. So this has actually taken a huge toll across the globe. So, so what happened was our professor realized this in a few days, that they are dealing with something very serious. It's not something which is as usual. So there are stories that this doctor actually went to Hong Kong to take a room in Metropole Hotel, actually not for attending the wedding, but to reach Hong Kong to get expert treatment in Hong Kong hospital, because he know that back in mainland China he is probably not going to get treatment, because even at that point the disease was not acknowledged as something SARS. It was just like some normal pneumonia. So his room number was 911. I don't know how he took that. So that was the room number. And then what happened was that he, as I said, he got admitted into a nearby hospital in day 2 after he reached hospital. After he reached in hotel, so he told the staff there that don't take risk, be careful. I am having something very serious. But Hong Kong people, doctors and staff, they were unaware of something like this. So many of them, scores of them got infected from him, and you know, um, many of them died from this infection, which Professor Louis gave to the staff, the nursing, and the doctors in that hospital. So when healthcare workers are affected, it's a serious issue because they are going to transmit it to other patients. Uh, the day he died, the next day, another lady who was living in the same floor of the hotel died, and she was actually um, she actually returned to Toronto from Hong Kong, and she died in Toronto, Canada. So that was first time in a century Canada has had to undertake quarantine because of this death in 2003. So this lady was actually the grandmother of our Professor Louis. So she flew from, after his death, she flew to Toronto, and where she died. There was another, so if you see, you can see some of the red spot here, the corridors, then there is a lift hall, then you can see, there are lift in the hotel. It's a huge hotel, and it was a huge wedding. It's a huge wedding. So there was a Chinese American businessman who shared the lift with our Professor Louis. He actually went from there to Hanoi. Hanoi is in Vietnam. So once he reached there, he fell sick, and he went to a French Hanoi hospital. Um, uh, but then, because they couldn't do much, he was again taken back to Hong Kong. But while he was in Vietnamese hospital, he actually gave infection to nurses and doctors. At least 50 of them succumbed to the infection from this businessman. In the same hotel, there were 3 Singapore tourists who has come to see Hong Kong. They were sitting in the lift lobby of the hotel on that same Friday evening, when Professor Louis reached the hotel. So they flew back after their visits 4 days back 4 days later, they came back to Singapore and they were sick. They went to the hospital. They infected 17 medical staff, of including doctors. And one of the doctors who was treating him, actually he flew from Singapore to attend a medical conference in New York. So he had a long flight. You can understand how what would have happened in the flight. And on the way back home from New York via Frankfurt, he was actually ill, and then he became the first case in Germany, Frankfurt. So the entire passengers in the flight were exposed. They flew to multiple countries in the world. They took across the globe. So that is how, you know, the infection, the SARS, actually became a pandemic. So it all started from a one case, a villager. Then it was had a super spreader who gave infection to Professor Louis. Professor Louis, some people speculate he actually understood and he wanted to take uh, expert management from Hong Kong. He actually came by a bus to attend this wedding in Hong Kong. He might have spread in the bus. He spread across people in the hotel, in the lobby, in the lift, and then it went on, as I explained, to multiple countries and killing hundreds of people. So meanwhile, hospitals in Hong Kong started to have more of cases. Health workers were getting affected. Even the chief executives of the Hong Kong Health Administration, they were sick and they went down with the disease. And in fact, people feared that the entire Hong Kong health system is going to collapse. So that much fear actually happened. But again, even when all these things were happening, China unfortunately didn't inform. According to the international health regulations, they were supposed to inform the WHO, but they didn't do that. And this was how it became a pandemic. So of course, when such a thing happened, um, there was always a suspicion of whether this is a biological threat or bioterrorism. Even this time, people saying, it may be, is it a possible bioterrorism? Of course, it's not. I mean, it can't be the case even that time or even now. The circumstances doesn't make us believe that this is due to this is a bio weapon that was created. But that fear was there because we know the anthrax was just over at that time, and world was like still coming in terms with bioterrorism. So so that was there. And Hong Kong was the busiest place in the world at that time, and the entire world was connected to each other through Hong Kong at that time. So yeah, of course, then the virus was isolated, and uh, slowly agencies got into work, and then people started using personal protective equipments in the hospitals. um, People were using hygiene practices, essentially involving hand washing and personal hygiene, when you are sneezing or coughing. So that actually prevented or halted the outbreak. So as I said, the United States government did a series of investigations and conducted a workshop. And some of the findings were that the fundamental issue of Chinese failure to address was organizational obstacle, health system issues. And these are not just problems for China. It's a problem for any country in the world, including India or even including United States. US is not so prepared to manage or address a large scale pandemic. We saw that in 1918. The same situation will repeat if something similar happen even now. And then, of course, in China, there was an issue of information flow, which is still there in many, even in India. If you go to many states, the local health administration will be reluctant to alert the higher people in the administration that if something strange they see, because they fear that they will be unnecessarily dragged to investigations and they will have headaches, so they will just keep quiet. And then, I mean, unfortunately, even if you remember the Nipah outbreak in Kerala, unfortunately, I mean, we claim ourselves that we did a good job. Of course, we did a good job. I'm not saying that we didn't do good, but no, we had the highest mortality rate in any Nipah outbreak in the world. Uh, our public health system failed, literally failed to detect the outbreak. It was a private hospital in Calicut, Baby Memorial Hospital, and the neurologist there and his team actually who suspected this as Nipah and initiated investigation. All the previous patients have gone to the public healthcare system, including primary healthcare centers, community healthcare centers, taluk hospitals, and even medical college hospital. Unfortunately, they were not detected at any point of time. So, as I said, all the factors that I have shown in this slide are relevant for any country, including the US, including India, and Kerala is not an exception. And China had an issue that they don't want anyone else to know this. They don't want anyone else to interfere. And, as I said in the beginning, the Chinese tradition of respect for senior scientists in position. What happened was that uh, the fun thing was that, you know, one of the senior doctors at that time, uh, I'm not so sure whether it is Professor Louis, but the doctor thought that it was chlamydia infection, which was causing that disease. Uh, and he had a couple of samples which were positive for chlamydia from these patients, and so they just concluded that it is chlamydia. But in fact, the junior clinicians were not agreeing to that. They know that this is something different. This is a more of a viral infection, not chlamydia. But then, a senior person saying that it's chlamydia, so just they took it for granted and they thought it's chlamydia. So that actually delayed investigations. Uh, Finally, when the Beijing laboratory finally, announced that it's SARS corona, it actually, already many weeks have passed, um, which actually took a heavy toll, as I described how it spread from countries to countries. And healthcare workers, interestingly, the pulmonologist, the doctor who attended the seminar conference, I mean, all of them uh, have contributed to the chain of infection transmission. So actually, it also exposed the weakness of the healthcare system in China, the lack of funding, the lack of an effective surveillance system, shortage in facilities and staff, preparedness, lack of preparedness, all of them were exposed. But it had a big impact. If you see this year's outbreak, China was very quick to diagnose the infection. In just few days, they isolated the virus, they confirmed the disease, they do even the uh, genetics, the sequencing of the viral sequencing, everything, genomics, everything they could do in a few days' time. And the hospitals they built in like just few days, they built huge hospitals. So, and they were better than last time in informing the world community that this is something, there's something wrong here. So that was a huge improvement from the 2003 SARS experiment. So coming back to the core issue of ethical issues in quarantine. So there is a point when you have to have a cutoff between the individual liberty and public necessity. So uh, there are a lot of questions on ethics when it comes to quarantine. First and foremost, as a public health professional, not only for quarantine but also for any issues of public health importance, you as a public health professional should be equipped to inform the government and the public that this is a public health necessity to take some action. So that is entirely on you. you and me as public health people, that is our responsibility to generate evidence and information and data to support that this is a necessity. Uh, whether it is for quarantine, whether it is for vaccine, whatever decision, whatever action you want to take, it should be backed up by solid evidence to say that there's a clear case of public health necessity to quarantine or isolate or vaccinate or whatever it is. So this has to come from your effort, and it has to be substantiated with data and scientific evidences. So this is very important. So this is can anyone guess what it is? Hmm? What is that? What did I say?
Teaching, someone teaching.
Yeah, yeah. So you're right. So basically, this is from the University of Minnesota in 1919, and that's a physics lecture going on. So basically, the government had advised every institution not to do things in closed rooms, do things in the open. You know, keep your windows and doors open all the time. Conduct meetings in open air. Uh, don't do hall meetings, even lectures. This is a physics lecture in University of Minnesota in 1919 when the professor is taking class in the open ground. So second thing, after public health necessity, the second thing that uh, as a public health professional, when you are advising on something, the ethical, which has some ethical implications. The first thing, as I said, you have to prove that there's a necessity to do something. Whether it is then when you are saying, this vaccination has to be done, you have to prove that it is necessary. Or when you are saying quarantine has to be done, you have to prove that this is necessary. Second thing is you have to have an effective intervention. So this is very important. So in this context, we have to understand that there are two ethical considerations in quarantine. One is it should be justified ethically. It should be justified. For example, can you justify quarantine for, say, HIV? Will you quarantine for HIV or TB? Do we quarantine for TB? Do we quarantine for TB?
They said no, they isolate TB.
Okay, so why do we not quarantine TB?
They said one of them said the social stigma issues.
The source will stay in
Social stigma. So social stigma issues, so they don't quarantine TB patients.
Yeah, that's an excellent answer. Yeah, of course, that's one of the main reasons. I mean, stigma is a big issue, and we know. I mean, quarantine essentially involves keeping patients who are not symptomatic, uh, but we suspect to be exposed. But then, if you do want to do quarantine for TB in India, you have to quarantine one third of the patients, one third of the people in India. So that's not practical. So you have to have an effective intervention. For example, vaccines. Um, so when you are saying that some disease is serious and you are saying vaccination is the solution, then that vaccination should be an effective vaccine. That's an ethical consideration that you should have. So the quarantine also should be ethically justified. And second thing is you have to justify that quarantine is effective. So as I said, TB, whether it is effective, it's not going to be effective. So that has to be kept in mind. So that's the second point, the ethical implications of any decisions that you take, including quarantine or vaccine. This is again during the 1918 epidemic, pandemic of flu. So you can see that this is a barber shop. Everything happened in outside. You know, there was the barber shops. The shops were closed. Essentially, all of these things happened on the road. Third point that you should consider is proportionality. So when you are asking for some decisions or some actions to be taken, it should be proportional. So what is proportional? So that essentially means your action that you are proposing should not be too narrow or too broad. It should be adequate to what is essentially needed. So it should be proportional to the public health problem. So you know vaccination for some diseases uh, may be essential for some group. For example, yellow fever vaccines. You don't advise yellow fever vaccine for every Indians, but yellow fever vaccine will be required if you are traveling to some countries in Africa where yellow fever is endemic. So you have to take some decisions based on the proportionality concept of proportionality, where your decision should be proportional. Your action should be proportional to the requirement. So this is all the four principles that I am saying are equally applicable from an ethical point of view for any public health intervention. Whether it is a disease control program, whether it is a vaccination program, whether it is a quarantine, whether it is a treatment program, whatever it is, your action, if you're looking from an ethical point of view, it should be considering all these 4 points. So the third point is it should be proportional. So this is again in 1918. So you can see that there is a young girl, a lady lying down, and then there's a child who is along her side and sort of crying. So basically, they are sisters. So this young girl found that her sister is not well. So this brave young girl, she actually telephoned the Red Cross, and asked them to come to their home. So actually, at that, as I said, it was a huge outbreak. Hundreds of thousands of people were affected. So they actually had a home service in Red Cross volunteers go to the home and manage them. So actually, they came and managed her elder sister. The fourth point from the ethical point of consideration is least restrictive setting. So especially this is important for quarantine and isolation. So basically, why do we do quarantine? We do quarantine from 2 points. One, first point, why do we quarantine is basically we want to help prevent spread of the disease, because the disease will spread only when there is a social circulation of the infectious agent. So basically, quarantine is one way to prevent that social circulation. So you are preventing or restricting the movement so that you don't allow the person to go out and spread out. Second objective is that you have a better opportunity to monitor that person who is suspicious of infection, so that at the moment you feel that patient is sick, you have an opportunity to test and diagnose and have better care for him. So there are two angles to quarantine. So these are that's why quarantine as a public health tool is still widely accepted, even though people say that it infringes on the personal liberty. Um, so there was a very famous case in 2014. So you might be familiar with Medicine Sans Frontiers organization called the Doctors Without Borders, which is an international humanitarian organization working in difficult settings. In 2014, there was a very curious case of uh, a case against quarantine in the United States. One lady called Cassie Hickok, actually, she went to volunteer during the Ebola outbreak in Sierra Leone. So when she came back from the Ebola outbreak, when she landed the the airport, Newark Airport, she was um, held up. She wasn't allowed. She was not allowed to go to her home. She actually spent 4 days in isolation um, by the order of the Department of Health in New Jersey. She claims she doesn't have any symptoms. She claimed that she didn't have any symptom, but she was unnecessarily quarantined. So they actually went on to fight a legal case against the Ministry Department of Health, because in US, there's a supreme um, provision in the Constitution of personal liberty, um, unlike most of the other worlds, most of the other countries. So so actually she said that being asymptomatic, she was not supposed to be quarantined. Uh, so actually we went. There's a problem.
But we can see here, I think it is okay. Because sometimes it goes on and then it dies.
Which one?
And this will, like even now we can hear you well. Like, even if you continue, that's fine.
Okay. So basically, she went on a legal case saying that no, her personal liberty was curtailed because she was unnecessarily quarantined, even though she was not symptomatic. Um, the case went for years, um, and this was discussed widely in the public health literature, like whether the Ministry Department of Health was right in quarantining her. So of course, she was asymptomatic. She claimed um, she was not properly assessed clinically before she was quarantined. There were a lot of logic, and she even claimed hundreds of thousands of dollars in damage in the federal court. Um, 2015, the verdict actually came that she wasn't. Her case was dismissed. The court was of opinion that you are a health professional. You went to Sierra Leone fully knowing that there is a risk and that this infectious disease pose a threat of spread. So when you came back, you were quarantined by the department in full faith, in public health interest. And then the records and all came out, and it was court was convinced that she was symptomatic. In fact, she had fever. A small increase in temperature was there in the records. So actually the case was dismissed. So there's a lesson for public health professionals here. So as public health professional, a health professional, we have a more we have more responsibility than ordinary citizens to be, for example, in such situations when you're coming from an area which is infected with a particular disease, um, you have to be quarantined, and that is obvious that you will be asked to be quarantined, and you have to actually cooperate with uh, such decisions. So there is a thin line between where your individual right end, the freedom end, and the public health large interest comes into play. So but that has to be, as I said, the government or the as an authority should prove that it is necessary. So in this case, actually in the court, the Department of Health was able to prove that it was a necessary intervention, and it was an effective intervention, and then it was proportional, because after a couple of days she was actually shifted to her home and kept at or under home observation, or home quarantine, what you call. So basically it was proportionate. It was least restrictive setting because it was in her own home. It was proportionate uh, to the because Ebola is a huge threat. Once it gets into circulation, it's a huge threat. It was an effective intervention. Quarantine is an effective intervention, and it was a public health necessity. So in that case, actually, the court was convinced that all the four principles were followed by the Department of Health, and therefore her case was dismissed. So again, this is again 1918. As I said, there was a huge demand of nursing staff. So people were just short courses were run to produce more of nursing staff. And this is one of the advertisements from Chicago School of Nursing. You just come and learn at home, and you earn 15 to $25 per week. That was at that time, like 100 years ago. So it was huge amount of money at that time. So yeah, so um, unusual circumstances demand unusual interventions, um, and that was what happened even at that time. So yeah, so this is what I have. I have not gone to the Liberia case because I know that you have read it, and I appreciate that you understood the seriousness of the issue. So the take-home message is you have a moral obligation when you are saying quarantine. We have a moral obligation to prevent harm. So that is the first point. So you are preventing harm, not to the general public, but also to the patient, because you are providing him with close observation, um, um, to prevent harm to him as well. Second thing, it should be a least restrictive means. So I think in Kerala, we are now doing an excellent job that most of the people are isolated at home or quarantine at home. So that's the least restrictive means. Um, Reciprocity. So what is reciprocity? So in reciprocity, what it means that when an individual is giving away his freedom, no, because you are going to be confined in four walls for many days. In Kerala, you are doing it 28 days. I don't know why 28 days. I mean, it should be ideally 14 days. I have asked some people. I mean, I'm getting some strange answers, but I feel that 28 days is not an evidence-informed decision. It should have been 14, because 14 is, the incubation period for some coronavirus. So anyway, so reciprocity means individual is actually giving away many of his freedom for the larger security and safety of the community. Therefore, the community has uh, to reciprocate it. For example, in the Liberian case study, you might have read that people, they are poor people living in the slums. They were closed. A huge area was closed. Hundreds of thousands of people, virtually they were in a jail, a large jail, and they are already deprived of food and money and job. And when you are in that situation, you are going to be quarantined. You can imagine how difficult it is for them to live. And actually people died when when there is a confrontation, when there are when there are people moving and trying to get whatever food they have. So actually that process actually killed more people. So reciprocity, and when you suspect that there is a disease infection, you are putting all large number of people in a big jail or in a village as quarantine. And there will be agitations. People will be struggling each other or fighting each other to get whatever food is there. So it actually spread more infection. It will do more damage than good. So reciprocity means in those situations, the government has, or the society has a responsibility to take care of their needs. For example, you have to provide food, you have to provide some entertainment. So in the 1918, there were some other images, where the army men sitting together, wearing the mask and watching movies. So you have to provide some sort of relief, some sort of entertainment, some sort of uh, you know uh, luxuries, because they are actually foregoing many of their individual rights and privileges for the betterment of the society. So there should be something called the reciprocity in quarantine. And fourth thing is transparency. So transparency is, and you have seen that in that case, um, in Liberia, people who can afford to give money to the security, they can escape. This happens in everywhere. This is not only in Liberia. It happens in for example, in Kerala, I was sad to see that a couple of medical students actually came from China. The parents are in Saudi, but because Saudi, as I said, will not allow them to get out of the airport, they went to Kerala. And from Kerala, they actually took a flight to China, to Saudi. So I mean, In fact, you are putting more people into danger knowingly, because you're traveling in a flight. You are going to infect a lot of people. You are reaching a country in the disguise that if they know that you are from China, you will be quarantined, but you are not saying you are from China, you are saying that you are coming from Kerala. So actually you are putting a lot of people into risk. That's very unfortunate that medical students are, I mean, this is unfortunate. So transparency means you keep everything transparent. The government should disclose the truth to the public. The government should disclose the necessity of such an intervention. The government should disclose what is happening to these people, and the government should disclose what are the effective treatment available for them. So, and also the government should be transparent that they should have um, equal amount of quarantine for all sections of society. Rich people can be quarantined in different ways than for poor people. That's not fair. That's not fair. So transparency, reciprocity, least restrictive means, and the and the conviction that you are doing it with a moral obligation to prevent harm. These are the essential things that you should consider when you are thinking of quarantine. So I will stop here. I think I don't have more slides, and that's the end of the slides. So if you have some questions on the ethical aspects of quarantine, I will be glad to discuss further.